Okay, so good afternoon. So I think it's a great challenge for everybody in this room to try to figure out how to put so different universes, as to say, like semiology, that means basically the sort of the gross phenotype associated to epilepsy, and it's even more complex when you look at the cognitive or memory alterations associated to epilepsy, for example. How to define those phenotypes? The complexity associated to the behavioral aspects of epilepsy is a level of complexity in which probably you have the very first picture, although you have no idea which are the mechanisms behind that behavioral observation. It is possible to figure out things coming from the clinical setting, but at the same time, you have models in which you possibly mimic some of the behavioral alterations associated to seizures. However, you have, for example, depression. We have talked about depression, anxiety, panic, some other things which are emotionally driven sometimes, depending on trauma in infancy, etc. How to evaluate this with the phenotype description? Sometimes you need to sort of make an interview with the patient, with the family. What about the models in which you have no way to ask the animals how they think about something? So you use artificial ways to do that through mazes, through protocols, to challenges to the animals, but obviously the model is not exactly a human being. So there is a nice review by Dr. Tom Insel at the NIMH, National Institute of Mental Health, which I recommend for everybody. He's discussing animal models or model animals or organism models, because the worries are not how close to the human being is a rat, because there is a huge distance. Yeah, but you may remember the statement, it is modeling, the best model of a cat is a cat in preferentially the same cat. So there is no way to model through rodents, for example, humans. But accepting that those models are limited, you sort of express through those inferences how we are mimicking some of the components associated to the human being. So in the beginning, the question is how to identify in those settings things that for history had been defined in supernatural ways sometimes. I have no explanation, so there is something like a blessing or something like a possession. This is a very, very, not exactly old, but it's a Renaissance picture in which a child is being taken by a spirit, and the miracle of Jesus Christ cures him from the seizure. It's not exactly a mechanistic or even a scientific explanation. So what about hysteria or so-called pseudo-seizures if you want? So the phenotype can be confused. Sometimes you don't have another tool like EEG or, if you want, recently fMRI. So what about the other part? When you have somebody suffering from epilepsy and relating this to his or her life during the lifetime? Or what about, as Steve showed in the opening ceremony, the artists that through their art explain how they feel about their seizures or their epilepsy in this wonderful book. Now, what about somebody that is taken by stress, a chronic stress, like in this case, you have this post-traumatic stress, you have a risk for epilepsy increased. It's not exactly the same alteration if you look at EEG, for example, but you have very close anatomical alteration, like a shrinkage of the hippocampus here in the MRI. What about if you look at actual seizures? This is a patient this is a temporal lobe epilepsy patient, which you can just record through video some of these alterations over time. This is a video with some frames showing some of these stages. And what about if you put this together? This is a very nice book by Andy Kanner and Schachter, of our visitors. And obviously, this bidirectional relation between depression and epilepsy makes that complexity even more complicated. So obviously, the animal models could mimic something. It is possible to look for some other mechanisms. There is a bidirectional relationship between these phenomena. And obviously, you need to look for clinical implications of those mechanisms, if they are mimicked or not through the animal models. So talking about the animal models, let me tell some stories that we have sort of developed over time, basically associated to some of these models. This is an audiogenic model in which you have these behavioral alterations over time. This is a sound that triggers seizures. It's a high sound, like 110, 120, 120 dB. You have this motor seizure. You have a genetic component for that. From that, we can go into having resistant animals or normal animals that through lesions develop these clusters of alterations which are exactly audiogenic seizures. And you can select strains. This is a select strain, the so-called Wistar audiogenic rat, which is similar to the Geppers, genetically epilepsy-prone rats, in which over time you have a decrease in the latency, the response to the sound, and an increase in severity over time. So you have a very quick response to the sound, a very high severity index. So with these strains, you can sort of do the same behavioral recordings and show that before the selection and after the selection, you have a very consistent response, which is a motor response induced by sound. And in there, you can sort of look for mechanisms. You can, for example, expose these animals to chronic stimulation. This is a composite of pre-stimulation, during stimulation, after stimulation, in which you have the response. These are exploratory responses. These are exploratory responses, etc., but before, during, and after the sound. And these are the wild running responses in the tonic-clonic cluster. While if you have 30 stimulations, one per day, you have a cluster of limbic seizures, which are basically the manifestation of the recruitment of amygdala, hippocampus, cortex after that repetition. So we are extending or expanding that circuit from the brainstem, which is the firstly associated to the seizures, to a new one, which is associated to an extension, maybe LTP dependent. Other models are in the literature. Basically, what we repeated was a Kindle model, which was defined in the literature through electrical stimulation of amygdala, hippocampus, or even piriform cortex, or models such as status epilepticus in amygdala, through which you can look for alterations in morphology. Obviously, using microscopy, fluorescence, all these techniques of morphology, you can look for alterations such as necrosis in several areas, look for neuronal alterations, glial alterations in others, or look for neurogenesis, which are positive alterations, because you have increase in neurons or proliferation after seizures, paradoxically. But the question is, which is the best model? It is possible to, through modeling, through our view of modeling, do a sort of sound neuroscience. So this, I may say, philosophical question is very nice from Jim Bauer, now at San Antonio, at the University of Texas. For our field to advance, we must move from a point of view in which each of us is working with our own personal, quantified, and therefore largely untestable model of how our part of the brain works, to shared, quantifiable, testable models. It is my view that realistic neuronal models are ideal for this purpose. And I think the view of the roundtable this afternoon is based upon this proposal by Jim Bauer. I mean, just share information, upload information, download information coming from somewhere else, and put that information all together. This is the purpose and the philosophy of neuroinformatics, in which everything needs to be shared. But it doesn't, but if I put something in the internet and it's available, but nobody understands because I'm the only guy that understands my protocol, because I'm sharing something that is usefulness. So sharing needs to be open in order to be used in practical. So talking about information available on the internet, we have worked, for example, in the modeling of neurons that are coming from neurogenesis, the animal models such as status epilepticus. And these models, or this reconstruction in 3D form, I made available on Neuromorpho. And from there, you can sort of download them and model on them. Dr. Rocky will be talking about more of this in his presentation. But basically, the information that we got from the model, we upload in the database. And from there, you can download and simulate things that we are not able to do on the bench over decades, for example. After that simulation, you predict from the model which could be the best protocols to be made on the bench. And obviously, this is our part of this protocol. The simulation of the performance path stimulation coming from the entorhinal means I don't need to do the experiment. But I'm doing the experiment using the morphology that is taken from the microscope microscope. So saying this is a realistic model of neurons in silico simulated through performance path simulation digitally. Obviously, I can sort of construct models of almost everything through this, obviously artificial and limited sometimes. And the question is how to model things such as neurons, glia, endothelium, which are this triad that we were talking about in the morning. You can play with these models. Obviously, that will give you tons of information. But coming back to the phenomenology, to the phenotype, this is, for example, the analogous of the Wistar audiogenic rat. This is older than our Wistar audiogenic rat, the Geppers, genetically epilepsy-prone rats. And in them, you have this so-called severity index, in which basically you sort of weight through severity how complicated or more extent is the seizure. So you have like a no seizure in the beginning, you have later on while running until the hyperextension of the forebrain, of the fore limbs and the hind limbs. For pharmacology, it's very useful and very clear. However, if you compose this with EEG, so at the same time you are videotaping the animal, you have the EEG, so called video EEG, you can look for alterations in both behavior and EEG at the same time, which is basically what we look for in the clinical setting. So you have these animals in the beginning, no alteration. This is basically an awake or desynchronized EEG in several channels. You have the beginning of the seizure in here with some startle response. This flattening of the EEG means basically the tonic component, the clonic synchronization, the clonic seizures with the synchronization of the EEG, and this flattening again, which is the immobility associated with the postictal depression, in which you have no memory or amnesia, no response to nauseous simulation. Eventually, you can test memory for the animals that they don't remember specific tasks they learned. So if you look at the repetition of audiogenic seizures, you can sort of have this kind of severity index. This basically measures while running and tonic-clonic seizures. But you can see that after some time, you start recruiting something that was absent in the beginning, where you have basically seizures coming from the brainstem. So after the repetition, you recruit for a brain, basically amygdala, hippocampus, and cortex. And this explains seizures such as this that are basically identical to those evoked by stimulation of the amygdala or hippocampus. That's why they are called limbic seizures. If you give some time for them, for example, like a month or 2 months, you don't come back to zero, although you sort of recover the previous response in the brainstem, meaning that there is some memory of this process. And this process is not exactly as strong as you have, for example, status epilepticus, in which you have multifibrous sprouting. In here, there is no sprouting, although you have some alterations into the amygdala that basically are almost all the time neglected. You have neurogenesis, although the neurogenesis and the sprouting are bigger into the status epilepticus models. You have some neurogenesis in here. It's not that clear, and the confocal microscopy is better off to see it. You have BRD positive immunofluorescence into the dentate gyrus. These are basically migrating neurons or new neurons proliferating. Is no glia, which is the one that's proliferating, not in this case, in which you have GFAP negative for BRDU. And you have a seizure, which is recorded into the EEG, although you don't have the multifibrous sprouting. So in this model, different from the status epilepticus model, which is strongest than the kindling, you have alterations indicating that the hippocampus is recruited. You can see the alterations in both amygdala and hippocampus after the kindling nicely into the EEG. So you can look at the anatomy of this. So in the acute state, you depend on the sound. So the seizures are coming from the brainstem or explained by alterations in the brainstem. And after the repetition, you recruit areas in the forebrain, such as hippocampus, amygdala, or even cortical areas. It is possible that some structures in the brainstem, such as substantia nigra, which are dependent on activation from sensory stimulation or some other pathways, are involved in the so-called endogenous anticonvulsant systems. So maybe part of their activation is part of the difficulties or not of these animals to have recruitment into the forebrain. And obviously in those strains, you can sort of look for some other alterations that are endogenous to the strain. It may be associated to the explanation of other behavioral alterations that we can call later on comorbidities. but they have no responding to the substantia nigra to muscimol, so they have probably a GABAergic failure. Probably they have no excitation like in oyster rats, so they are more excitable. This is in vitro. You have alterations in other genes associated to excitation. And in the cardiovascular and respiratory system, these animals are hypertense, they are tachycardic, so probably they could be a nice model of risk for alterations associated to respiratory or cardiac alterations. In that case, a nice way to show a comorbidity in a genetically developed strain. And if you look at the HPA axis, that means hypothalamus pituitary adrenal axis, you can see this animal have hyperplasia into the adrenal medulla, and the whole adrenal gland is hypertrophic. So they have a hyperactivation. It is obviously associated to the expression of behavioral alterations associated to stress, HCDH, and the HPA axis. That could be probably associated to the sudden death and basically associated to the trigger by sign of death, sometimes seen in children. Obviously, other alterations that are at least interesting. These animals have these alterations in enzymes and in components of the angiotensin-renin system. And from there, you can treat these animals, for example, with classic hypertensive drugs, and they behave as anticonvulsant, which is sort of a cross pharmacological phenomenon, quite nice. These are measurements made into the hippocampus of those animals. And at the same time, you have other alterations, molecular alterations in genes in the hippocampus, which are endogenous markers, for example, the fMRI enzyme, which is associated to Fragile X syndrome. If you put these animals into status epilepticus through pilocarpine, you need less pilocarpine than oyster rats, so they are more prone to seizures evoked by convulsants such as pilocarpine. So the genetic selection of them translates into more susceptibility to convulsants in subthreshold amounts. Again, what if we take everything from these models, in different models, and look at the target, should be the clinical setting. So again, I think using computational models, we can sort of trace from the literature, from our own experience, and try to model which will be the best way of explaining things that will need decades or maybe hundreds of years in order to develop those protocols. And from there, having the limitations, obviously, of the computing or the computing models, coming back to the clinical settings, and look at the predictions made by the algorithms or by the models. So basically, that is the open ASCO is a presentation, the relationship between the data and the knowledge. Most knowledge in modern neuroscience is acquired through the collection of data, theories and models contributed by different researchers. In this perspective, the sharing of data, of electronic tools for the manipulation, and of computational models, the trust of neuroinformatics is an obvious and essential practice in the path to discovery. So in order to finish my presentation, let's then go back to the proposal of modeling and try to keep track of all the information I presented in the beginning and say, okay, how computational neuroscience can help us in predicting things we think are important. And obviously, semiology is the very beginning. We have nice documentation of this for the last years. This is a nice book by Olaf Sporns, Neurotoxic of the Brain, in several presentations or graphic presentations of modeling, several topologies, several ways of measure interaction between items into the so-called modeling, several ways of presenting the data through matrices, of adjacency matrices, or some other ways of looking at clusterization, interactions, connectivity, etc. Probably not for sure. Charlie will be talking about that. Probably Dr. Rocky. And among all of these models, for example, the so-called small world concept and the scale-free network has been useful in order to sort of try to explain how the interactions between either anatomical areas, functionally activated areas, or even semiology, which is our proposal, can be connected through this modeling. And obviously, we'll be discussing this at the end with you, how useful will be this for our purpose. So these are basically examples of this. For anything, you can sort of connect areas, you can connect functional areas, you can connect basically time series of events or spots of brain areas activated in health or in this is. So in 2008, when we began this neuroscience proposal, when we are doing this symposium, I proposed in this review what I call a puzzling challenge in contemporary neuroscience, insights from complexity and emergence in epileptogenic circuits. And what I draw in this, this moment was when we have the literature coming from our lab or from the world, we can sort of make a story that makes sense for us. When you put data coming from our lab, obviously the best way to say this is a nice history with sequence temporal and spatial is when the story is coming from us. When we send this paper to somebody else, okay, come on, what is the question? What are the results? Why you didn't discuss this or that? So you are in the middle of something like this, as a puzzle like this, which is absolutely clear. You put the pieces of the puzzle and everything is clear. Or maybe this is the reader of our proposal, but it's not exactly clear. So I think when we are constructing science, we have the data, we have the elements of the data that we interpret as naturally conveying information. But when we tell that story to somebody else, it is possible that they don't understand anything, or they understand as much as we, if they are from our area. But sometimes we feel that. If I tell this story of animal models to a clinical person, sometimes they say, okay, so what are you talking about? So sometimes the physics say, okay, to me, okay, well, so you model this way or that way, that explains this so easily. So why are you telling me that? I don't understand anything. So basically we are playing that puzzle thing, which is what in philosophy Thomas Kuhn has told us since the 70s. Science is a puzzle strategy, or puzzle solving strategy. So I think the change of paradigm has been exactly to use sort of a more complex view of our data. Systems biology applied to the design of drugs means that the promiscuity in biology, so the diversity of receptors that are being selected over time in evolution, is a model to be designed for the drugs needed for solve specific questions in pathology, like neurology or neuropsychiatry. And that's nice to see that, for example, the International League Against Epilepsy in the Epilepsy journal has taken this very nicely. And this systems epilepsy, a pathophysiological hypothesis, is basically the rescue of a proposal of complexity inside epilepsy. It's not exactly the explanation of single things happening when you recognize that it's a focus, and there is an extension of a network with activity, etc. It's more complex, as we have seen all over these 2 days. If you look at the epilepsy, the most important international agency in the world, International League Against Epilepsy, the logo is epilepsy is still a puzzle. So in order to finish, okay, this is again videos coming from patients, it's temporal lobe epilepsy patients for our surgery program here in Ribeirão. One of our PhD students, Maria Luisa, is in the organizing committee also. So you have, for example, repetition of seizures on the same patient in the videotape setting. You have different expressions. Probably there is a cluster in which you have this repetition. For some reason, you have only this repeating all the time. How we can evaluate thinking in a systems biology or in a complex systems point of view. Well, we proposed this in a recent review, and we say that complex challenges need complex solutions. And obviously, we need to decide if we are looking at the phenotype as a gross alteration in behavior, or we need to look at the mechanisms in a very tiny scale. We need to have all of them interacting. That's the problem. So we need to talk to the physics, we need to talk to the people from imaging, we need to talk with the people with a clinical background, and put together things that are together in the individual, they are together in the brain, they are together in the whole organism, but are separated in our minds. So I remember people sometimes in some laboratories say, okay, the inferior colliculus is from somebody in whatever place in the world. Come on, the inferior colliculus is from the rat, or the inferior colliculus from the animal, or something like that. But we have this tunneled vision, yeah? So these are, for example, the expression towardle, which is a free available program in which you have the expression of the font size associated to the frequency of those behaviors. In this case, left temporal or right temporal lobe epilepsy. So the semiology is different, it's asymmetric because it's different because of the connection between the two sides. And basically what we intended with this drawing was to say that although it's a temporal lobe epilepsy patient, the expression of the semiology depends on the whole brain. And obviously, if you look at this probably so complex expression of these seizures in patients, even repeated seizures associated or not with the SPECT, for example, ictal SPECT, we don't have solution for that. But you can use tools like computational tools, either to see a graph of a single seizure, eventually the network inside those seizures. We can propose several ways of showing this. It's a graphic analysis of those behaviors. And obviously we can sort of measure them through several measurements. So I don't want to go into the details. This is Caius, one of our students is presenting a poster on this. It is in that paper, so those flow charts coming from those patients can be transformed in something like an adjacency matrix, and you can sort of calculate how much these are related to small wordness or clustering with high association of individual behaviors, but at the same time they connected through single lines to other clusters of other behaviors. This is very nicely demonstrated for anatomy. This is very nicely demonstrated for functional anatomy. We are proposing this for semiology. And because, as I'm saying, we have these three universes absolutely working in the same place, in the same organism, obviously with the limitation of the time resolution or the time scale, obviously we have no way still to do that composite image. That's the proposal. Maybe I'll be asking Joao or some other people how to put this together and look for coherence functions, for example. How coherent is to have an epileptic seizure coming from the temporal lobe, left temporal lobe in a patient that has that semiology, and the functional MRI and the SPECT from the ictal SPECT is hyperflux in specific areas of the brain, for example. So this is a way to transform a flow chart, classical flow chart, into a graph. And from there, maybe to trace some specific paths between the behaviors, which are for sure are reflection of the alterations in the substrates, anatomical substrates. What is neat is this is not different than the connections we have on the internet between people, like social networks. This is not different than the connection between authors of articles, which is a construction of a network. So we are not talking about this something new, we are talking about something that connects everything, basically. We need to know the rules. And basically, that kind of connection can be made just with people that, first of all, adopts a way of thinking which is open. If you are physics, you need to be open to biology. If you are biologists, you need to be open to clinics. If you are clinic, you need to be open to something else. So you need to translate and create interfaces to your other bodies to be talking to you. So these are very specific moments or time windows of our laboratory. Some of the faces you are recognizing here. We can do art together with science. We did the NeuroArt Symposium in 2003 before the 2008. Some of the faces you have seen these days on the secretary are our graduate school students, they are postdocs. And the last question is, well, we need to have young people thinking in maintaining the story, have critical, creative thinking. And this is in Rome, in the International Epilepsy meeting. This is in the Scuola di Atenas, Rafael Sanzio. This is the Scuola di Atenas, or Athens School, famous painting. This is Poliana. This is one of our students in the secretary. He's postdoc in our laboratory. And Clara and Freddie, who are here with us. We need to have this history behind us. We have the future that depends basically on the young people thinking widely and expressing that interaction. This is Paisajes Neuronais, a celebration of the 100 years of the Premio Nobel, or Nobel Prize to Cajal. This is Javier de Felipe, this is the mentor of Lydia Alonso Nanclares. And these are thanks for the foundations and the people that help this to happen here. So more than 1 year ago, you needed to save the date for this event. Now we are here. So thanks for coming. Thank you.